There is a vitamin shortage that can imitate the early stages of dementia so closely that families start planning for a nursing home when the real answer was a simple blood test. It can numb your hands and feet, blur your memory, flatten your mood, and drain your energy, and it often begins its quiet work in your 40s and 50s, long before anyone thinks to check for it. And here is the part that should get your full attention. Caught early, it is often reversible. Missed too long, some of the damage becomes permanent. I am Dr. Hale. In my 15 years in internal medicine, I ordered one particular blood test on almost every patient who came in worried about their memory or a strange tingling in their feet. And again it caught something that everyone around that person had already decided was just age. The shortage is low vitamin B12. It is far more common after 40 than most people realize, and the reasons it creeps up on us are hiding in things you would never suspect, including a very common medication millions of people take every day. Stay with me, because I am going to walk you through the warning signs in the order they usually appear. The 4 everyday reasons your B12 quietly falls as you get older. And near the end, an honest word about what B12 will not do for you, because there is a lot of nonsense sold on that promise. The sign most people get backwards is the one about memory, and I will show you why. First, let me explain why this vitamin matters so much, because it changes how you hear the rest. Vitamin B12 does 2 big jobs. It helps your body build healthy red blood cells, the ones that carry oxygen, and it helps maintain the protective coating around your nerves. Picture the wiring in your house. Every wire is wrapped in insulation, so the electrical signal travels cleanly from one end to the other. B12 helps keep that insulation on your nerves intact. When B12 runs low for long enough, the insulation starts to fray, and a frayed wire does exactly what you would expect. The signal gets weak, it crosses, it misfires. That is why the symptoms of low B12 are so strange and scattered. They are the sound of wires losing their coating. And here is why this shortage is so sneaky. Your body keeps a large store of B12 tucked away in your liver, enough to last a long time. That sounds like good news, and in one way it is. But it also means a shortage builds in slow motion. You can be absorbing too little for months or even years while you slowly draw down the savings account, feeling only a little more tired, a little more forgetful, with nothing dramatic to sound the alarm. By the time the tank runs low enough to cause clear symptoms, the shortage has usually been building for a long while. That slow burn is exactly why it gets blamed on age. It arrives on the same gentle timeline that aging does. Now here is the order those signs tend to arrive, and I want you to notice how easy every one of them is to blame on simply getting older. Early on, it is often just tiredness, a deep, flat fatigue that sleep does not fix and coffee does not touch. Your red blood cells are not carrying oxygen the way they should, so your whole body runs a little short of fuel. Most people push through this for months and call it a busy life. Then come the pins and needles, a tingling or numbness that usually starts in the feet or the hands, sometimes described as walking on cushions, or gloves you cannot take off. This is the frayed nerve wiring talking. According to the National Institutes of Health Office of Dietary Supplements, these nerve-related symptoms are a hallmark of B12 deficiency, and they can show up even before a standard test flags a problem with your red blood cells. Next is balance. People start feeling a little unsteady, reaching for the wall in the dark, walking like the floor is not quite where they expect. When the nerves that tell your brain where your feet are start misfiring, your balance quietly suffers. There is also a quieter sign that shows up in the mouth. Some people with low B12 develop a sore, smooth, oddly red and glossy tongue, or a burning feeling on the tongue, because the fast-growing cells there are among the first to feel the shortage. It seems like a random, unrelated complaint. A tongue that just feels wrong, so almost nobody mentions it to a doctor. But stacked with the tiredness and the tingling, it is another piece of the same picture. And here is the sign most people get backwards. The memory and mood changes. Brain fog. Forgetfulness. A low gray mood or a new irritability. Families see this and their minds jump straight to dementia, and they never once think the word vitamin. Reversible dementia from low B12 is well described in the medical literature. That is the whole tragedy and the whole hope of this video in one sentence. The exact symptom that scares families the most is often the one most likely to lift with treatment, if someone checks in time. Let me show you what that looks like in a life. I will call her Eleanor, a composite of many people I have cared for over the years. 71 years old. Her daughter brought her in genuinely frightened because Eleanor had grown forgetful, teary, slower on her feet, and had started dropping her keys because her fingers felt clumsy and half numb. The family had already toured a memory care facility. Before we accepted that story, we ran a simple blood test. Her B12 was very low. Eleanor had been on a common acid-reducing medication for years and had slowly stopped eating much meat. A few months of treatment later, the fog had thinned, her energy was back, and her fingers could feel her keys again. Now, I will be honest. Not every part came back all the way, because the deficiency had run a long time. That is the lesson written in bold. Early is everything. So why does this happen, and why does it happen more as we age? Here are the 4 common reasons, and at least one of them touches a huge number of you. The first is stomach acid, and this is the one almost nobody understands. The B12 in your food is locked to the protein in that food, and your body needs strong stomach acid to pry it loose before it can be absorbed. Think of stomach acid as the key that unlocks B12 from your meal. As we age, many of us make less stomach acid, a condition that becomes more common decade by decade. Less acid, fewer keys, less B12 unlocked from your food, even when you are eating plenty of it. The National Institutes of Health Office of Dietary Supplements specifically notes that many older adults do not have enough stomach acid to absorb B12 well from natural food, and suggests they get more of their B12 from fortified foods or supplements, because that form does not need stomach acid to be freed. The second reason follows straight from the first: long-term acid-reducing medications. The drugs many people take for heartburn and reflux, especially the strong ones taken for months or years, work by lowering stomach acid. That is the whole point of them. But less acid also means less B12 unlocked from food. The NIH notes that these acid reducers can interfere with B12 absorption over time. I am not telling you to stop a medication your doctor prescribed. I am telling you that if you have been on one for years, your B12 is worth checking. The third reason is a diabetes medication called Metformin, one of the most prescribed drugs in the country. Long-term Metformin use is linked with lower B12 levels in a meaningful share of people who take it. Again, this is not a reason to stop a medicine that is helping you. It is a reason to ask your doctor to keep an eye on your B12 while you take it. Many doctors already do. Some forget. There is also a deeper mechanism worth knowing, because it explains the more serious cases. Unlocking B12 from food takes stomach acid, but absorbing it takes one more thing: a special helper protein your stomach makes, called intrinsic factor. Think of intrinsic factor as the boarding pass B12 needs to actually get on board and be absorbed lower down in your gut. In some people, an autoimmune process attacks the stomach cells that make this helper, so even perfect B12 in the diet cannot get where it needs to go. This is a condition long known as pernicious anemia, and it becomes more common with age. It is one of the reasons a doctor does not just say, "eat more meat," but actually looks into why a person is low, because the fix depends entirely on the cause. And the fourth everyday reason, the one you control most directly, is diet. B12 comes almost entirely from animal foods: meat, fish, eggs, and dairy. So if you have moved toward a mostly plant-based way of eating, which many people do for good reasons after 40, you may simply not be taking much in. Mayo Clinic notes that people following strict vegetarian or vegan diets are at real risk of B12 deficiency unless they use fortified foods or a supplement. This is not an argument against plant-based eating. It is a reminder that this one nutrient needs a plan when animal foods come off the plate. Let me pause here for something important. If any of this is landing, if you take an acid reducer or metformin, or you eat little meat, or you have felt that tingling or that fog, do one thing for me right now. Subscribe to Dr. Hale, and comment your age below so I know who is watching. Then send this to one person over 40 who takes an acid pill every day. You might be handing them the exact test their doctor has not thought to run. All right, back to it, because now I have to keep a promise and tell you the honest side. Here is the honest part, and it matters because the internet is full of it. B12 is not a magic energy booster. It is not a cure-all. If your B12 level is already normal, taking extra will not give you more energy, sharpen your memory, or make you younger. All those glossy promises about B12 shots for vitality are aimed at people who are not even low. Your body uses what it needs and clears the rest. B12 fixes a problem when there is a problem. When there is not, it does nothing but lighten your wallet. The whole power of this vitamin is in catching a real shortage early, not in megadosing when your tank is already full. There is one more honest note about testing, so you can be a smart patient. A basic B12 blood test is a good starting point, but it is not perfect. Some people can run a level that looks borderline normal and still be functionally low. If your test is on the low side of normal but your symptoms fit, a good doctor can order a couple of follow-up tests that catch what the first one misses. So if you get tested and are told you are fine, but you still feel that tingling or that fog, it is fair to say, "My number was low normal, can we look closer?" That sentence has saved a lot of nerves. Now here is your plan for this week, the simple version. 1. If you take a long-term acid reducer, metformin, or you eat little to no animal food, ask your doctor to check your B12. Just ask. It is an inexpensive, ordinary blood test. 2. If you have noticed tingling or numbness in your hands or feet, unsteady balance, or a new fog and low mood, do not file it under just getting old. Write down when it started and bring it in. 3. If you already know your level runs low, ask your doctor which form is right for you, a pill, a stronger oral dose, or a shot, because the answer depends on why you are low in the first place. 4. If you eat mostly plants, look at fortified foods or a simple supplement, so this one nutrient is covered on purpose, not left to chance. 5. Do not start megadosing B12 on your own to feel younger. Fix a real shortage if you have one, and do not chase a benefit that is not there if you do not. And now the part I never skip. There are signs that mean you do not wait. If your numbness or weakness is spreading quickly, if you are suddenly very unsteady or falling, if your memory or confusion is changing fast over days and weeks rather than slowly, or if numbness is climbing up your legs, those are reasons to see a doctor promptly, not at some future checkup. Fast changes always deserve a faster look, and low B12 severe enough to cause those changes is a medical issue to be treated, not managed with a bottle from the shelf. Here is the honest boundary on all of it. This is education, not a prescription. I do not know your history, your medications, or your test numbers. So take what you learned here and bring it to your doctor. Ask the B12 question. Ask about your acid reducer or your metformin. Let the person who knows your chart decide what is right for your body, not a video and not the comments. Whether you are 45 and quietly noticing your feet feel a little off, or 70 and afraid your mind is slipping, Please do not let anyone, including yourself, write off a reversible problem as simply the years catching up. Sometimes the fog is not your future. Sometimes it is a vitamin, and the fix is close. Now, B12 is one of the deficiencies that hides behind the mask of aging. It is not the only one. There is another common shortage that shows up first in your hands and feet with that very same tingling, but comes from a completely different cause, and it is one that quietly damages the smallest nerves before anything else. If you felt a chill of recognition when I described the pins and needles, that next video is for you. Subscribe to Dr. Hale so it reaches you, and I will see you there. Take care of yourself.